So hello, my name is Andy Powell. I am an AISMA board member and I'm also a partner in the healthcare team at Mazars. I've been asked to deal with the following question. Is this going to be a bumper year for practice profits because of the additional money coming in from the COVID vaccine clinics? And everyone's going the additional mile to protect their patients during the pandemic, should practices be offering a staff bonus? I think it's probably just worth going quickly over the funding of the COVID vaccination campaign. The key difference is it's being done at PCN level rather than at practice level. And the funding available is £12.58 per vaccination given. And there's additional premiums for nursing home patients and also recently announced for home visiting. That's required. So there will be income coming in, and given the number of vaccines going out, obviously headline figures look quite significant. What each PCN needs to do though is establish really what its costs are, and it has various costs. The key one is obviously staff costs, and what will happen there is practices will pay out for any staff costs through the payroll. Based on an agreed formula, and that may differ from PCN to PCN. And bear in mind, it's not just the rate of pay that each staff member gets, but you need to add on and factor in on costs such as employers' national insurance and employers' pension. Employers' national insurance is at 13.8% in the main, employers' pension at 14.38%. So quite sizable add-on costs that go on to anyone's pay. Factored into that, there will be differential rates of pay potentially from nursing, from doctors, from admin staff, and PCNs need to consider that. And also then on top of that, it's not just the cost of the clinics and the time of the clinics. Certainly all the PCNs we've seen operate, the huge amount of meetings that go in before each clinic, to plan these, to chase patients, and that's both at PCN level and practice level, so that cost needs factoring in as well, because that's a cost that's going out. There is costs relating to the financial management, because the money will come in at PCN level and need to be distributed out to practices, so that needs factoring in. So really what we would suggest is at PCN level, you need to be all over your costs and actually understanding what the cost breakdown is of providing this service, so that you can actually ascertain if there is a profit. Then you have to sort of decide how to deal with that. And the key thing is obviously trying to keep it simple at the moment. You've got enough hassle on your hands at the moment dealing with the vaccination side, and distributing the money has to be simple, and it has to match where that cost is going. Will it make a huge profit? I think it probably depends on the type of patient and delivery. I suspect the first few clinics that PCN's provided, given the huge amount of setup costs, the reimbursement coming in really would not have matched the costs involved, particularly the time costs. It may, as you go into the younger cohorts, be more profitable as you can increase the throughput of patients through surgeries. That's but a lot of those may go to mass vaccination clinics. Certainly practices are being left to perhaps the harder cohorts to deal with, which involves a significant amount of chasing of time. Also, even if the vaccination side of things does make a profit for a practice, it has to be seen in the context of the overall practice finances, and there are other income streams that have reduced over the last 12 months, particularly income streams outside the NHS. So, cremation fee income has reduced, private rental income for rooms has reduced. So the overall context of the COVID vaccination income has to be seen in that context and looked at in the whole as how practices are doing. However, practices have to be accepting the huge amount of effort going in at staff level at the moment, and have to be clearly making sure staff are being paid, and clearly making sure if there is a profit that that has to be dealt with across the wider team once everything else is taken into the equation. So it's not a straightforward answer. Every area will do things differently, and every area will have to make decisions on how they've structured their clinics. but try and keep it as simple as possible. You've got enough things on your plate at the moment. Let's not overcomplicate it.